Hello, good
Yes.
afternoon.
Afternoon.
I'm Amal. I'm the dean of UPSAT Tunis Health School. I would like to tell to Roderick and to Isa, thank you very much for sharing your success stories with us, and we hope that all our candidates will not only work as nurses but also as managers in their career. And my question is about is there any bridge between other bachelors and nurse career? For example, anesthesia, for example, or physiotherapy, if they have a bachelor in Tunisia in these specialties, can they reach a career of nurse in UK?
Isa, do you want me to?
Yes.
Yeah. So, what, based on my experience when I'm actively recruiting in the Philippines for my own hospital, so we only recruit based on what degree they have finished in their country of origin. So, if you decide that when you come here and you want to do something else, you will have to enroll yourself, or the hospital, if they are happy to endorse you and pay for your education to do another degree, then it's not as regularly happening, because when we employ individuals, they are already considered as what they finish in their country. So I, for myself, qualified as a Bachelor of Science in Nursing in the Philippines, and when I applied here, I got a nursing job, and then I decided I want to do management, and that's when my hospital gave me some funding to do some management degrees during the course of my years working in the same hospital. So it's like an incentive that they've given me to do more on the management, but I'm still managing the clinical side of the hospital, and they equip me, they give me all the information and education that I need and the skills that I need to become a manager. But if your question is about from being a nurse to become a pharmacist here, it's gonna be difficult because you need to get the same qualification of a pharmacist equivalent to this country.
Yeah.
That's
Again, sorry. What happened is that if you want to cross border about any profession in UK, it's your choice. You can. It's up to the university to assess your application. Some university do what they call a pair. They can appeal, because when I came here with my degree too, they were able to appeal me, and I was able to do my full BSc nursing because I have the diploma in Nigeria at that particular period. So in that process, I was able to finish my nursing degree and also go ahead. Although initially I supported myself to have an MA in management, but later when I decided to do a MSc, I was supported by my trust, who actually, because the investor have offered me that yes, I can be into that program. Once you are, the investor has vented your qualification, then it's up to you to seek support from whether the educational development unit of your trust, who mostly they have a sort of support, continued professional development funding that are there. Sometimes you can apply to, and that is the issue. Or some charity organization within the trust who can support you with certain amount of money. Like now, I'm doing a doctorate program. My trust supported me in that regard. I started with the CPD first. They award me some money to continue to do research in certain area of my specialty I want to do. And also now, at the end of my program, which is very shortly, with my doctorate program, they are also supporting me in that regard. But it's all about the university once your qualification is okay, they have vent your qualification and they feel they can appel your education, and that is fine. You can cross-carpet any profession you want to do. That should be your choice. But there's anything, the trust will depend on how relevant that is going to be to them at particular something. I don't know whether I've answered your question on that.
Thank you very much. It's okay. Thank you.